Hi, I'm Dr. Michael Gordon of Gordon Schanzlin New Vision Institute, and we're very proud that we are now a TLC center. We thought it'd be a wonderful idea in this day and age of computers and webinars to hold a seminar as a webinar. You're going to learn about LASIK surgery, you're going to learn about new advances in LASIK surgery, Contoura vision. You'll hear about the experience of Alex Gervasi, who's one of my patients. You'll hear about costs and how to finance surgery and some answers to frequently asked questions. I started in 1980 with a very basic procedure, which is the only thing at that time, and that was called RK, stand for radial keratotomy, and that is we made incisions in the cornea to change the shape of the cornea, dependent on the length of the incision, the depth of the incision, the number of the incision. And I got involved in the very earliest, very first clinical trials for laser vision correction in 1989, and had been involved really in every advance in the clinical trials of laser vision correction since then. The latest and the greatest, I think, and I think most people would agree, is something called Contoura vision or topography-guided LASIK. And what this entails is really, when you break it down, we're incorporating more information into your treatment. We're incorporating information that is very specific to you, like a fingerprint. No two people have the same fingerprint. Well, no two people have the same prescription, have the same curvature of the cornea, have the same shape of their cornea, have the same aberrations in their cornea, and that's what we're measuring, and that's what we're treating with Contoura vision. I invited Alex Gervasi here, who's a patient who's had LASIK surgery, who has an extremely compelling story. She's active, she's young, she works, she's got a great job, an interesting job, and I think this really did impact her life.
It definitely did. I'm an on-air personality here in San Diego for Channel 933. And so I work long hours. I have a great job, a fun job, but I'm always, out and about in the city and doing things, and had very poor vision, very poor vision. And so for me, doing this procedure has been something I've wanted to do for a while, but it's always something I thought about doing, but I never really put the wheels in motion, because I'll be honest with you, it was scary. It was a little bit daunting, because you only get one pair of eyes. So I was nervous about that. But let me tell you, if there is anyone that you need to trust with your eyes, it is this man and this team here. What always struck me was you really put me at ease, and you answered all of my questions.
One of the things people fear is it going to hurt?
Yeah.
And it really, I'll let you answer that.
I was going to say, it didn't. I mean, it's a weird thought to feel like there's someone literally correcting your vision, your eyes, and something that's such a life-changing procedure, that's so fast is really mind-blowing to me still a year later. So
Alex, you're a very busy lady.
Yes.
I know you do a lot of things. You're on radio here, you're on radio there. This had to impact your lifestyle. And it's always interesting to me as a surgeon how that impact really changed things for you.
It changed a lot. I work very long hours, and I think because I have a very fun job, but it can start, at 8 o'clock in the morning, and then I have to go to events right after work, and I'm not getting back home until like super late at night. And so I was someone who always liked to wear contacts. And by the end of the day, I can't tell you how many times I would blink out my contacts just because they were so dry. And, you can correct that with eye drops, but then knowing me, I would forget the eye drops. And then I'd be on my last pair of contacts. Like, it was just always a hassle. It was always annoying. I would be somewhere. I remember one time, I think I went home and I was in my grandparents' pool, and my contact blinked out, and that was my only pair I brought. So
you're stuck.
It's just, yeah, exactly. Then you're stuck. So I think just for me, not being in the studio and feeling like my eyes are irritating me, because when you're at work and your eyes are irritating you from looking at a screen so long or what have you, that's distracting because you're now focused on how annoyed you are with what's going on up here. I know it would be a distraction. I would lose focus. And so that is just one less
Well, it's
thing.
interesting. The most fun for me, the thing that's most gratifying in doing this surgery is how it changes people's lives.
Yeah.
One of the frequently asked questions is, how safe is LASIK? And there have been a number of studies now in peer-reviewed literature that have shown LASIK to be a safer alternative to vision correction than contact lenses. Is it safer than glasses? Well, it may not be safer than glasses from certain standpoints, but it's safer when you look at life and what life can bring you. You don't know if you're going to have an earthquake. You don't know if you're going to lose your glasses and you have to get out of the house because your child has to go to an emergency room and you can't find your glasses. This provides ultimate visual safety for you. When you come to a consultation at our office, it's essentially a comprehensive eye exam. And we're looking for reasons not to do LASIK. We're looking at your cornea. Is there anything on your cornea that tells us you shouldn't have LASIK? You'd be safer not having LASIK. You're here for about an hour. You have many, many, many exams. I examine your eyes. I look at all the numbers and measurements we've done, all the images we've gathered to determine whether you are a good candidate or not a good candidate. And there are some people who really should not have LASIK, and that's what we're looking for. We love to do LASIK. We think we change people's lives, but we don't want to do something that may have an adverse effect on your life. So we're doing a very, very comprehensive exam to rule in or out whether you're a good candidate. When people are looking to have laser vision correction, people shop around, people go to different offices. And I think one of the things you need to be careful of is, do you offer something other than laser vision correction? In other words, we offer basically everything that's available to correct your vision, we offer it. Whether it be surgically, LASIK, PRK, corneal collagen cross-linking, ICL, which are lenses that you can put in the eye, refractive lens exchange, glasses and contacts, if you want to go in that direction. So you need to be careful when you're looking that it's not, if all you have is a hammer, everything looks like a nail. So you want to go to somebody that has more tools than just a hammer.
The fee for laser vision correction is $24.75 an eye, and that covers the procedure itself, a year's worth of post-operative care, and lifetime enhancements if you are eligible. We do everything that we can to make sure that we can assist you in this life-changing process. We honor our servicemen and women by offering military discounts. We offer financing, and in some cases, you could be a candidate for insurance or corporate discounts. We also want you to take advantage of your pre-tax dollars through your FSA, HSA, and HRA accounts.
One of the things we all consider is this is a medical surgical procedure, and cost is certainly one factor, but you have to factor in the benefits to your life, the safety, the surgeon, the team that's involved in doing it. And I think those are major considerations, and cost is certainly a factor.
I've been working with Dr. Gordon here for several years, and I am your advocate. So if you have any questions or concerns, please feel free to contact me, and I will hold your hand throughout this whole process.
So I invite all of you, as we conclude this webinar, if you're interested, the exam is a comprehensive, free, complimentary exam to see if you're a good candidate. You meet with the surgeon when you come in. You're not just coming in for a screening exam. And I invite all of you to come in and talk and visit this and see if it's something you may want. See better and stay classy, San Diego.